this is Debbie Lynn Toomey, Tufts Medical Center's Injury Prevention Coordinator. You are watching Aging Strong, which is found under Health Links. And Aging Strong is a program that's sponsored by the City of Quincy's Health Department. And today I have a special guest, one of the public health nurses from the Quincy Health Department. Her name is Caitlin Pico, and she's going to talk about her role and focus a lot of her program on fall prevention. So Caitlin, welcome.
Yes, thank you so much for having me, Debbie. I'm very excited to be here.
Oh, I'm excited to have you on because, you know what, a role of the injury prevention coordinator it kind of goes almost in the realm of public health because we do a lot of outreach work and education and prevention work. But for me to be able to interview you, a public health nurse, it'll be very interesting for me to understand your exact role. So, I know you have a presentation to share, and as you're trying to put that up, maybe you could share with us, how did you get into public health nursing? How did you, what made you kind of focus in that instead of bedside nursing?
Yes, well, to be honest with you, so I had started nursing. I had graduated with my associate's degree, and I went right into correctional nursing. So I was a nurse for 2 years in a prison system. And working there was a lot of assessments, a lot of immunizations. We were doing a lot of vaccines for the inmates. So when the job for the Quincy Health Department, one of the nurses had retired, and they were actually having a little bit of difficulty filling the role at the time. Maybe people didn't know it was available. So I applied, and when the then previous commissioner saw my application, they were very excited with that history of immunizations and all of that. So getting into public health, I didn't totally plan on it. I'm so happy it ended up that I am in this role now. When I get into my slides, I'll kind of go into different responsibilities we have as public health nursing. Because a lot of times when I say I'm a public health nurse, people have no idea what I do. Because if you think nursing, you think bedside nursing. And there's so many different roles out there.
Exactly. I'm glad you shared that because the stereotype of a nurse is somebody at the bedside, right? Walking a patient or helping them, giving medications to a patient. But there are different specialties out there, like what you do, public health. And there's also nurses who work in the industries and organizations, the occupational health nurses, right? Yeah. And of course, there are the nurse educators as well. So our role can be so vast, and it's amazing how you could use your strength and also your passion and use the profession of nursing to be able to kind of deliver that particular, work or career or passion.
Yes, we recently hired it's been over 6 months now, a third nurse with us. And as I'm training her, I'm like, you never know what the call's going to be when a call comes into the office. But I was like, we just do our best to handle it, to provide resources if the individual is looking for resources. And it's a lot of coordinating with the state health department and local agencies in our community to help residents find what they're looking for.
Yeah, that's wonderful. Wonderful. So again, I know you have a slide presentation, so I'll keep you in doing that.
So for today's topic, I really focused on fall prevention. And a lot of this information I obtained from the National Council on Aging, along with the National Institution on Aging as well. But just before I jump into that topic, just to jump in a little bit of what public health nursing is. And this varies from city to city, town to town. Those nurses might have a little bit different roles than myself at the Quincy Health Department. But a big part of what we do as public health nurses, our biggest role is communicable disease control. And the way that we go about this, especially, it's very easy to think of we just where with COVID-19, that was, we played a huge role in that. So basically, with communicable diseases, we're thinking anything that's very contagious. So COVID-19, foodborne illnesses, vector-borne illnesses. So if that's a tick or a mosquito. And what happens is when you get diagnosed in a hospital and you have a lab result that tests positive for any one of those communicable diseases, the public health nurses in the city or town where you live gets notified, and we do a investigation. So we would call you, we get clinical symptoms, and we're really trying to figure out where you maybe got sick and who else could get sick. So we would, where this is all state guidance, of course, and state guidelines that we go by. So whether you need to quarantine or if people around you needed to quarantine, we're the ones who work with the doctors and work with that resident to make sure they're doing it properly so nobody else gets sick. So there's a lot that goes into that, and depending on the disease, we have to ask different questions. And again, this is all mandated by state guidelines. Mm-hmm. And under that too, another big role we do is like tuberculosis. So we would do tuberculosis case management, and we would follow them for the course of the treatment to make sure they're responding well to treatment, going to their appointments, and in the end, of course, no longer infectious with that communicable disease. Other things we do in Quincy, we do the blood pressure clinics, and we have those every Wednesday and Thursday from 10 to 11 at our senior center. And we also have a big role in vaccinations, not as much as in the past. I know prior to me working in the health department, I started in 2018. Years before that, residents would tell me that they used to go to the health department to get all their vaccines. But then with primary care providers and private pharmacies in the community, people are more going to their doctors and to those pharmacies for their routine injections. But we do offer in the Quincy Health Department B12 injections. And if people have that assigned to them or ordered by their doctor, they could reach out to us and inquire if they wanted to come in for those. And then we actually, in 2022, we just reintroduced the homebound flu vaccines. And those are for residents that in Quincy that are homebound, that can't really get up and go to a doctor's office easily, or maybe they're bedridden at home. So we were able to implement that last year, and we already started it again this year. And we found that very beneficial because a lot of those people that were classified as homebound, when they would call to get their flu vaccines, their doctor would say, call the local board of health. And I would tell them to call their doctor. So it was kind of like they had no resource and nobody could come just give them a flu vaccine. So we were very happy to re-implement that in our community.
That's great. So Caitlin, do people need insurance to cover the flu vaccines, or is that something that for a residents of the city, is it free for them?
So we do go by, so the city buys it, but we do go by insurance. So we would have to put the insurance information in when we do provide that vaccine. If you don't have insurance, I would still say call us, and we could either like recommend another facility for you to go to where you could maybe get a free vaccine. So we're willing. A big part of our role is providing resources in the community that's better for people. So even if you don't have insurance and you're homebound, give us a call and we can try to see how best to work with you to make sure you get that vaccine.
Mm. Okay, thank you.
Yeah. And then, of course, a huge part of our role in prevention is community education. So, of course, with this Quincy Access Television programs, I know you have your role through Tufts Medical in this program, Age and Strong. I also do my own health links, which is once monthly. I go over different health topics. And my coworker, Deb Deary, she also does a presentation every month, either at the Kennedy Center, our senior center, or she even has started going to different senior living facilities in the area. And we really go based on what people want to hear. So when we go to a presentation and like today's on fall prevention, for anybody who's viewing this, I always say, give us a call if you want to see another topic, because we do our research. We find all our information either off the state or the CDC. And that's what we're here for, is to provide education to the community to help prevent some injuries that could be preventable, of course.
That's great. Thank you.
Course. And then I also just wanted to touch on, I didn't put this on the slide, but another thing that we do in the community, that because we, of course, in the Quincy Health Department, we work very closely with housing inspectors. So if there was ever, we do it if there's any children under 18, or if there are 50, I believe it is 60 and older, if they are identified as at risk for unsanitary housing conditions or potential hoarding conditions, we nurses actually respond to those cases. We are mandated reporters, so we do have to report any situation we go to South Shore Elders. And that facility would then screen them, and they would put a social worker to check in to kind of see what resources they can provide to that resident to make sure that they can live safely in their home. I could go on for those hoarding situations for the full hour today. So maybe we'll have to touch back on that on a different day. But that's definitely a big role that that public health nursing does. We try to just provide resources to help them live their safest, best life.
Thank you. Yeah, definitely we'll have to have you back to talk about hoarding, because that can be a very big issue, safety, and also in so many different levels. It could be health, it could be fall safety. There's so many different ramifications. So definitely would love to have you back again to talk about hoarding.
Absolutely. I would love to.
Okay.
Yeah. Okay. So now we'll just jump into, before we jump into falling prevention, I just wanted to go over some facts. And this is all according to the National Council on Aging. Over 1 in 4 adults over the age of 65 fall each year. And falling is the leading cause of fatal and non-fatal injuries among adults. And then each year, over 3 million injuries caused by falls are treated in emergency departments, which includes over 800,000 hospitalizations. And then I thought this last one was very important, that falls in older adults without injury can still lead to fear of additional falls, physical decline, depression, and social isolation. So with some of these very alarming facts, but when you look at that, how many injuries are treated in these emergency departments and how many hospitalizations, it's tough to think of this way, but the cost on the back end of that. So if you do have an injury and you fall and you break a hip, you need to think that's the emergency room evaluation, your hospitalization bills, potentially a rehab after that. So it can be very costly to have an injury, as we all know. And that doesn't even go into medications you might have to take, physical therapy, occupational therapy. So that's why I always say in every QATV show I do, prevention is the best possible route, because you want to prevent any of these injuries to help prolong your best life and your independence as best as you can. And I thought that last fact about the older adults and the fear of falling, because you have to think of that. If you have a fear of falling, and so it makes you, I'm just going to sit on the couch all day because if I don't get up, I'm not going to fall. But that's really the worst thing you can do, because if you're not up and moving your body, your muscles aren't going to stay strong, your bones aren't going to stay strong. So it really just puts you at risk if you're not continuing to move your body as best as you can. So in these next couple slides, I'll just jump into some different measures of prevention that are very important to consider as you're aging in your home and community. So there could be, of course, many causes for falling. This is just some different topics that were highlighted by the Council on Aging. But some causes could include vision changes, hearing changes, and reduced reflexes as we age. We all know as we age, you're not quite as sharp as you once were when you were younger. So like if you were walking and you went to trip on a rug back in the day where you could have maybe caught yourself, it's not as easy to react to get yourself safely to the ground. So when I get into these prevention, you want to make sure you're really staying on top of your vision and hearing, and making sure you're going to your doctor routinely, whether you need glasses or if you need hearing aids. Make sure you're doing what your doctor advises you to do, because they're giving you that advice to keep you safe, obviously. And there are many different health conditions, but just to name a couple, diabetes and heart disease, or any issues that affect your thyroid, nerves, feet, and blood vessels, especially those lower extremities, your legs. Any of these conditions, with diabetes, the feeling in your feet is not as strong as it once had been due to the nerves. So you want to make sure, if you do have these conditions, you're wearing proper footwear and you're taking care of yourself to make sure that you're ambulating the best way possible. And make sure, of course, you're taking your medications prescribed for these conditions as you should be. Other conditions that put people at high risk that you might not think about is something like incontinence. Because when people have conditions, and it's not even just incontinence, you could have GI issues. Say you had Crohn's disease, and it's not as easy for you to wait to go to the bathroom. A lot of times with incontinence, it's sudden. So they have an urgency to get up and run to that bathroom. And so with that urgency, you're not taking your time. You're not really looking where you're stepping. So it really increases your fall risk. And then it's very important to think of cognitive changes. So as we get older, there are different conditions like Alzheimer's. So you need to think with these cognitive changes where your mind is not thinking as clearly. You want to take into consideration that there are certain medical conditions such as a UTI, a urinary tract infection, that could temporarily change your cognitive health. So make sure you're taking care of your overall body, just because if you were to have cognitive decline, your risk for falling is up because you're not as vigilant around you and where you're moving and all of that.
Mm-hmm.
And then, as I keep mentioning all these medications for your health conditions, it's very important to know what the side effects of your medications are. If you don't know, contact your doctor or even your pharmacy where you pick up your medication. Your pharmacist could go through those different interactions or side effects, because you don't want to take a medicine that's going to make you drowsy and then try to walk a mile with a friend, but because you're not going to be as alert and you're not going to be safe on your feet.
Mm-hmm. Mm-hmm.
And then just the last one, there was, as I say, there was a ton more to go through, but definitely addressing safety hazards in your home or your community. Your home is definitely a big one, and I will go into some of those measures you can do in your own home. Because you want to make sure that's where you are every day. That's where you're ambulating around, you're using your bathroom. So you really want to make sure your paths are clear and there are no tripping hazards that increase your risk. So we'll get right into this preventing falls. And again, always my favorite topic on any show. So when you prevent falls, you want to stay physically active. So again, if you're an older adult and you had either a scare with a fall or you did fall with no injuries, you might think, that's it. I'm just going to sit in my chair. I'm fine. I'm safe here. It's really not true, because again, you want to be up and moving, because different activities such as walking or swimming in mild strength training, those activities help build strength in your muscles. They keep your joints and your tendons flexible as we age. And also that strength training can help keep your bone health very strong, especially if you're suffering with osteoporosis as you're aging. Strength training is an amazing tool to use, and that keeps you strong. There's also important to focus on exercises that actually focus on your balance and strength. In some, there's a lot of different programs out there today, of course, but yoga and Tai Chi are two that were mentioned. And I wanted to quickly mention here, check in with your local gyms or even your senior centers in your area to see if they offer any programs that are right for you. Because I know in the city of Quincy, our Council on Aging at the Kennedy Center, they coordinate amazing programs. I know we have a chair yoga, they have Tai Chi, they have pickleball. So again, it might not be for you, but maybe go and try, even go to a class and maybe watch them and see if you'd be interested, because they're great resources. And I always, whenever I tell people to increase their exercise or to attend classes like this, I always say check if you have an occupational therapist, that's great, or check in with these programs, because these programs are ran by licensed professionals that are trained to teach these programs. So they'll teach you the proper way to lift the weight, the proper way to do each movement. That way you're not overexerting yourself and hurting yourself ultimately.
Mm-hmm.
Yes, I always like to say that. And also with walking, make sure you're doing it safely. Especially if you live alone, if you're going out for a walk, make sure you're checking in with somebody, whether it's a neighbor, a loved one. Either give them a call or send them a text message to saying, I'm going out for a walk. So that way, if a couple hours goes by and they notice you're not home, they know to check in on you.
Yeah.
That's always very important.
Yeah. I like the slide, Caitlin, because it's just, it it's a nice reminder for all of us to keep moving, basically, keep active. So even if you want to go to a local senior center, and if you find, oh, I don't want to do Tai Chi, oh, I don't want to do yoga, oh, I don't want to do pickleball, at least you're out of the house. And at least you're able to people watch, or maybe play games or meet new people, do puzzles. They have so many different activities there in the senior center that doesn't really require exercise per se, but it's just a way for you to get out of the house and do something different. So that way you're reducing feelings of loneliness, or, feeling bored. And you can feel a little bit good about yourself, knowing that you did something good and something different for yourself, for your mind and body that day.
Yes, we have a lot of residents that come just to hang out with their friends and play bridge.
Mm-hmm.
I know on some rainy days, I'll see some of the women just walking up and down the hall too, just to get their steps in. So it's a great place to go, and they welcome all. So definitely check in with your local senior center and see what they offer, because it's been lovely, and we're very lucky in the Quincy Health Department that we're located right in our senior center. So it's very nice. We are very interactive. We work very closely with our senior center.
And also, I want to add, there are people who love to walk in malls. So we have a big mall that's enclosed. It has 2 levels in the Braintree area, and people do mall walking. So some people like to walk outside and do the circumference of the mall. Some people like to walk inside, and that's actually a good walk because especially during the wintertime or when it's rainy, you can just go and walk the whole length of the mall that way too. So there's different ways to get your exercise in. So just be as creative as you can be and just keep moving.
Yes. I always end that. I'm like, I don't expect you to go sign up for a hot yoga class right now. I was like, I just want you to find maybe what's right for you, what works for you in your life.
That's right.
So now this is just continuing on with our prevention. I had mentioned, again, you want to maintain those vision and hearing screenings regularly with your doctor. Once again, with those medications, know your side effects. You don't want to be blindsided with fatigue and dizziness after starting a new medication. And you also want to avoid substances that can alter your mobility. So avoiding or limiting alcohol is very important, because as most of us know, if you do have too much alcohol, it does mess with your gait, makes you unbalanced, and your risk for falling increases significantly. And then the use of assistive devices to increase your steadiness. And I thought this was very important because in my research, if you feel you need an assistive device, check in with your physician or an occupational therapist to decide what the right device is for yourself. Because a cane might work for your friend, but you may need a walker. And there's so many different types of these devices on the market at this time. So your physician and occupational therapist, if you have one, they're a great resource because they know you and they know your limitations. And they can also provide great education on how to use these devices. So it's very important. You don't want to just go to a random store and grab one and be like, this is mine now. You could be okay, but if you're using it incorrectly, that could also be a fall risk to you. If you're dependent on a cane, but you're not using that cane correctly as you walk.
Yeah, I love this slide because it reminds me of when I used to be a bedside nurse. And I worked in the medical surgical floor, and we took care of a lot of patients after knee surgery or hip surgeries. And so these patients would, the day after surgery, or that was a long time ago. Actually, now it's a day of surgery. They get them up really quickly. It's really important for the right trained professional to get them up, and that would be the physical therapist. And the physical therapists are the ones who is going to teach them proper ways to get out of bed so you can do it in a more comfortable way without re-injuring your hip or your knee, whichever, part of the body you had surgery to. And what they do is they really teach you the right way to hold on to it. They measure the cane or the walker to your proper height. And also they teach you which foot to step into if it's a walker, which foot to use first, so that you are more balanced. So for people who are being gifted used canes or walkers, that's great because it helps reduce the cost. At the same time, it's also good to know the proper way to do it. So if you are finding that you do need these assistive devices, still ask your doctor for a physical therapy and maybe occupational therapy consult, so that way you are taught the right way to do it. So you can minimize your risk for falling.
Yes, that's very important. So next we'll jump right into fall proofing your home. And a lot of times, like you could, when you went on the website for the Council on Aging, they have room by room. You can go through this room by room, all different things you can do to make your home safer. But some of the big takeaways I found was definitely keeping your floors and stairwells clean. As I mentioned in the beginning, my role in the Quincy Health Department, we get called to homes that are potentially unsanitary, unsafe, or potential hoarding. And a lot of times you go there, and again, with age, it's not as simple. Those everyday tasks of cleaning your home, they're not as easy. But a lot of times, if you're leaving your mail on the floor or boxes on the floor, books, like whatever it may be, anything that's left on the floor becomes a fall risk. So make sure you're keeping your paths clear as possible. Also ensure your stairways have good lighting and secure railings. When I was doing this research, a lot of lighting got brought up in a lot of the cases. And a good thing that we're seeing now with technology are those sensor lights. So you could even, I believe there are light bulbs that could be censored. So when you plug in your lamp, it would know, or it could be more a plug, but it would know when you walk in the room, the light will go on, rather than you walking into a dark room for 20 steps trying to fumble with the light to turn it on. So definitely as technology is advancing, things like motion detector lights in your home could really help you down the line and help you stay safe. Another thing, you want to make sure your rugs are very secure to the ground. A lot of times with small area rugs, although they can be very pretty, those can be very good tripping hazards. Whether you have an assisted device or if your feet are on the ground and you just happen to kick up that rug, you really want to get rid of those small area rugs as best as possible. You want to make sure you're not walking on wet floors and cleaning up spills quickly, if necessary. And a big room that can be a hazard for falling is bathrooms, because a lot of times that's a lot of hard surfaces, the bathtub, the floor, the sink, it's hard surfaces you're falling onto. Also, they can be wet surfaces because you're showering in there, you're bathing, you're brushing your teeth. So a good thing that you could install are railings. Railings to assist you getting into the bathtub, out of the bathtub, even by your toilet seat if you feel that would help you stand up from your toilet. And then even just in research, like things like they have different toilet height seats, that you could get a toilet seat that's taller. So definitely that if you feel your toilet seat's way too low and you're having trouble getting up, there's different resources, whether that's replacing your toilet or getting a commode to go over the toilet to lift it up a little higher. It's really just, you want to think of your home. That's where you are every single day. You go to the bathroom there every day. So you want to make sure you're making everything in your home as easy as possible for you to use to help limit your risk for falling in that home.
Yeah.
And just like as I keep saying with a lot of these topics, there's so many more. You had to think of cords on the floor, wearing proper shoes when you're ambulating. I know my great aunt used to put heels on no matter what, and we were like, please wear sneakers. But definitely secure shoes. Make sure you're as safe as possible, always. And then this could actually be my last slide for this topic. But this is what to do, of course, if you do fall, because it is a very scary situation. So first thing, when in this information, I did want to just make sure I reiterated that this, what to do if you fell. I got this information right from that National Council on Aging. So the first step they recommended was take a moment to breathe and try to remain calm as best you can. If you instantly pick, because our first thought is, oh my God, I fell, I need to stand up. If you instantly panic and stand up, you could either hurt yourself even more. So before you get up, you really want to assess, are you injured? Are you bleeding? Do you feel your leg is numb? Kind of give yourself a second to get your head straight and figure out, are you injured before quickly rushing up? If you fall and you are able to crawl to a sturdy chair, or if you feel it's safe for you to roll on your side to help stand up, so basically, if you're able to stand up on your own, make sure you get up very slowly, because a lot of you will be rattled. So if you stand right up, you could get lightheaded and fall right back down. So definitely take those steps slowly. Maybe get up to your knees and hands, sit there for a moment, and gradually help yourself up. Once you are up, or if you cannot get up and there are people around you, you want to call 911 or ask for assistance. I want to mention, if you fall and there are people around you, maybe before you get up, try to get some assistance from someone around you. So that way, if you are injured, they know and they can help you get up. They can call 911 for you. Very important, if you are alone and unable to get up, try to get in a comfortable position and wait for help to arrive. I know this can be hard, but I always advocate for anybody, but especially older adults. Try your best to stay in communication with loved ones, friends, a neighbor, especially if you're living alone. So that way somebody's coming to check in on you. So that way, if you do fall in your home, but you call somebody every night around 6 o'clock and they don't get that fall, it will send alarm bells in their head. Why haven't I heard from this person? Should I go check on them? So that's why you had mentioned that even with going to the senior centers, that's why staying social is so very important to keep yourself safe, to keep your mind sharp. Um, and after a fall, so either you're injured and you would, if EMTs are there, they'll either assess you or bring you to a hospital for assessment. If you fall and you're not injured, I still say check in with your doctor. Because a lot of times there could be like different medications. If you're on a blood thinner, if you stand up from a fall and you're like, I have no injuries, I'm perfectly fine, you could have an internal bleed. And if you don't address that, you don't talk to your doctor, that you could pass away from that. So it's very important, even if you're not on blood thinners, check in with your doctor just so they're aware, they can keep track. And if it does become a pattern, they can try to assess and reevaluate your medications and all of that to kind of help you steady yourself on your feet, and make sure you're safe for time to come. Mm. And I want to say, even for myself as a nurse, we do respond to a lot of falls in the senior center. And I have to say the majority of the falls we have are just from people like accidentally, they won't pick their foot up and they might just trip over their shoe. It's very small incidences, but even myself, I walked into Target one day. It was a Saturday morning and I'm walking into Target by myself. And it was a woman, an adult woman and her elderly mother. And the mom tripped right in front of the store and hit her face on the ground. And I walked over instantly and I was like, I'm a nurse. And they spoke another language as well. English was their second language. So when I had said, I'm going to call 911, the elderly mother was, I'm fine, get me up, get me out of here, I'm going home. I still called. By the time 9 EMTs arrived to the scene, her face was swelling. Turns out she was on blood thinners. So it's your first instinct is to be embarrassed. Really, unfortunately, when people fall, because it's an accident. So when people fall, their first thing is, don't look at me, get me up, get me out of the public eye. Take a deep breath, take a minute. It's best to know that you're safe, because even that woman who fell in front of that store, if I walked away and didn't call 911, she would have went home and that swelling could have continued. She could have gotten severely hurt from that. Yeah. So I just want to make it a point. I know it's tough, obvious, like it's tough to not get embarrassed in these situations, but just take a moment to remain calm and try your best to not rush out of these situations, because again, they could be more severe than you yourself even realize.
That's a very good point, Caitlin. Thank you for sharing that. Yeah.
Yes. And it's just, I always find it's always the people, it's not always, but like people who turn down the help, once help arrives, they're like, thank God they're here. So it's even if you're a bystander, maybe just call so someone can check in on them just to make sure they're okay.
Yeah, very good.
Just to end here, I just wanted to provide, I know I keep mentioning these resources, but the National Council on Aging and the National Institute on Aging, they had so many different resources on these links, different links to click onto, how to make your home safer, how to educate yourself more on fall preventions, and different programs in the area that you could maybe attend. Like, for example, even with the Quincy Health Department in our collaboration with you and Tufts Medical, these do provide a lot of information to help our residents and communities all around us.
Great presentation. I wanted to, I have some questions here based on what you shared with us. So as you're coming off the screen share, let me just kind of look at my notes. Let's see. One of the questions I had was you talked about in the beginning being a part of the chain of people who looked after the people who have communicable diseases. And so if somebody, one of my neighbors, had maybe say, for example, TB, I think you mentioned TB, how would they know to contact the Quincy Health Department? Usually a person, if they were sick, they would contact our doctor. So would it be their doctor who would contact the health department, or are we encouraging the patients themselves to also call the city?
Yeah, so we could actually do a whole nother episode just on communicable diseases as well. Because ultimately what happens is, so you would go to your doctor, they would do testing, basically. If they believe suspected tuberculosis, they would test you for it. If those lab results come back positive, they go into a state database called MAVEN, and it's secure. The reason I have access to it is because I'm a public health nurse. So it's HIPAA protected. So if a Quincy resident tested positive for tuberculosis, we would get notified on that state database. There's also a TB team at the state level who we work very closely with to coordinate all of this care. But basically, we would then get in touch with the state health department team. We'd coordinate with the doctors. A lot of times these individuals will be hospitalized when they're started on TB medications. So before they're discharged, that case manager in the hospital has to reach out to the local board of health, and they pass on the care to us. So basically, as soon as they're home from the hospital, we go and we set up a medication box with the medicine they got from the pharmacy at the hospital. And we fill the medicine box. We make sure it's the appropriate medicine, appropriate doses that are ordered. And we actually watch them. It's called DOT, direct observational therapy. We watch them take that medicine for 5 days a week, especially at the beginning of treatment. Treatment can last 6 to 9 months for TB, depending on the person, could be longer. But we would set up their medicine, and we're kind of in between. We're an easy access between in the community to their doctor. So if they're having an adverse reaction to a medicine, because a lot of times with the TB medicine, you will see those reactions in the first couple of weeks of taking them. We would then coordinate the care with the doctors, whether they're at, we work with Shattuck Hospital, Boston Medical Center. I've had a patient at Tufts before. So we work with all different doctors, different teams. But we would do the DOT daily. We'd check in with them and manage their medicines all throughout their treatment. And it's kind of like if people, a lot of times, we'll have individuals who are arriving here from China or India, any community really. Those are just two that we see largely in Quincy. But if people arrive and before they get here, their overseas medical records show that they're at risk for tuberculosis, when they come here, I'm also notified, and I do a referral to a TB clinic for evaluation. So it's very in-depth, but we really just work closely with the families, and we want to make sure that they're taking the medicine as prescribed, because it's hard treatment. It's not easy medications to take. A lot of times we have been seeing with the TB, even they feel perfectly fine, but then when they're on the medication, it makes them feel sick. So they're like, why am I taking this? It makes me sick. So it's a lot of education and reinforcement and collaboration with those doctors at whatever facility they're being seen at in that state health department.
Wow, that's great. Um, so how the case manager would not contact a visiting nurse. They would instead contact the health department to be able to have the patient be managed properly at home. How is that distinguished? What is
It's just for tuberculosis cases.
Oh, okay.
Yeah. So it's only if they're diagnosed with TB, the public health nurse, we become the managers of that case. We're case managers for them. So we do a lot, because a lot of times with these cases where they are families that are coming over here from other countries, a lot of times we have a language barrier. They may have other barriers, like I know transportation's a very big barrier. So we collaborate with the state to get vouchers for taxi rides to and from hospital appointments. So it's only for those TB cases we do this. But we just help because it is a communicable disease. And even if they have TB and they're not sick at that moment, as they progress, it can worsen, and they can also spread it to everybody in their families. And so that's like another big role is we do the contact tracing. So we would get the household contacts tested. Depending on lab results, we might have to get their work contacts tested. So it's very in-depth, and it's just a lot of collaboration to make sure that they're safe in receiving the treatment they need to receive.
That's wonderful. I didn't know that. So as far as the evaluating the risk for the family members who live with that patient, would you go into the people's home then and do the TB test? Or would you refer those people to their own primary care?
So we actually, so we have been doing the PPD testing, like right in the arm. As of the last 2 years, the state now, through a lab facility that's kind of in all different communities. We have one located in Quincy as well. But basically the state health department will pay for that lab result. So I would get the voucher from the state, the lab order, and then I would bring them to the residents in Quincy, and they would go to Quest Diagnostics with that lab slip. And based on that lab result, we'd be able to tell if they need their own evaluation at a TB clinic or if they're fine without treatment.
That's wonderful. Yeah. Again, I didn't know that service was provided for residents. Do you know if other cities or towns in the area also provide TB?
So I will say, where Quincy, we're located very close to Boston, of course, and our transportation in and out of the city is very good here. So, and we're a very large city. So we tend to see a lot more I shouldn't say a lot, but say we have like 4 or 5 TB cases at a time. And again, these are gradual. They recover, they'll get more cases as more people arrive. But basically, Quincy, we see a little bit more than other towns. But I always think of that, it's more so, it's not that they don't have it, but it's just like, say, Braintree, for example, they might have 1 to 2 cases a year, where Quincy might have 5 to 10 cases a year. So working in Quincy, I really have in my time in this department, I've had a lot of experience with TB cases, and it affects people differently. So I've had a lot of experience, and it's nice to kind of see, and it's nice to better help people, see what works for them, might not work for this family. And we do understand, I always say this to my cases, we understand our role is pretty invasive because a lot of times these individuals are sick in the hospital, they're told they're diagnosed with TB, and then they get a phone call from me and I'm like, hi, I'm Caitlin, I'm going to come to your house. And they're like, whoa, like, who are you? What's going on? So it's a lot of education and just because other countries potentially don't treat TB the same way. I know a lot of my cases will tell me back at home, if you have TB, they don't treat you this way. But we try to treat everybody with respect and dignity and work around their schedule because we do know a daily visit is a lot. It's very invasive to people's lives. One good thing that came from the pandemic is now we are allowed to do FaceTime videos on our phones through different apps, of course. But that way it's more of like a 2-minute FaceTime, just watching them taking the medicine, making sure they have no symptoms. They can hang up and move on with their day. Rather than when I first started, we had to go to that home every day, which can be a lot for people.
Yeah, that's a very good point. Telehealth is, one of the benefits that came out of the COVID pandemic.
Yeah.
Oh, yes, definitely. So we're at the top of the hour. So is there what are one or two things that you want the viewers to come away with from, your presentation today? What are the really the big key ideas or education or any type of information that you want them to come away with?
Yeah, so the biggest thing I would say, I know I've said it 10 times, prevention is always key. That is the best way to go about anything is preventing. So as we age, especially staying in the home, we want to maintain our independence and we want to stay safe in our home. Definitely stay active, look at your community, see what resources are out there, whether they're exercise classes, social gatherings, health topic related, either videos or in person. Really just stay connected, stay moving and keep yourself healthy and safe.
Yeah, very good points all around. So Caitlin, I want to thank you for being my guest today. I hope the viewers got a lot of valuable information and maybe reminders from your presentation because I learned so much. It makes me really proud to be in partnership with the Quincy Health Department to be able to do this Aging Strong outreach work that I do for Tufts Medical Center. So I want to thank you for that. I want to thank the viewers for continuing to watch this program and also the Quincy Health Department for sponsoring this program. So until next time, everybody, stay safe and well. Take care now. Bye-bye.